Let me ask you a question. What do you see when you look at My Cat Moo? I know what you're thinking. A cute, fluffy, British, long-haired boy, right? Wrong! You are looking at a weaponized vessel for antibiotic-resistant superbugs that could wipe out humanity. But yes, he's also quite cute. ESCMID Global is an annual congress that brings together the world's foremost experts in clinical microbiology and infectious diseases. And this year, they found something startling. As if humanity didn't have enough to deal with, the wars and global warming and inflation, it turns out that our beloved companions in cats and dogs could be spreading antibiotic-resistant superbugs to humans. Do you have anything to say for yourself? So before we talk about the antibiotic apocalypse, we need to understand what antibiotics actually are. Antibiotics are probably one of the most important discoveries in mankind's history. Before their discovery, bacterial infections like pneumonia, tuberculosis, or even skin infections were often deadly. Life was a very risky game. It was the equivalent of playing video games with one-hit kill mode enabled. But the discovery of antibiotics changed everything. They helped us recover from potentially lethal infections and change the landscape in how we treat disease. And it all happened by accident. A Scottish doctor called Alexander Fleming left some petri dishes containing bacteria in his lab, and then he went on holiday. When he came back, he found mold in one of the petri dishes, and around the mold, there was no bacteria. The mold had created a bacteria-free circle around itself. It took another 10 years before scientists at the University of Oxford would eventually develop penicillin into a drug. This discovery was a miraculous turn of events for humanity. To grasp the monumental impact penicillin and other antibiotics have had on human life, consider these stats. In the earlier 20th century, global life expectancy was around 30 to 40 years old. Today, it has soared to over 70 years, with antibiotics playing a crucial role in managing infectious diseases that previously shortened lives. Antibiotics have helped control and eliminate the threat of epidemic diseases, such as typhoid fever, cholera, and syphilis from many parts of the world, changing the face of public health. Before the advent of antibiotics, the death rate from bacterial pneumonia was a staggering 30 to 40%. Today, thanks to antibiotic treatment, it's reduced to under 5%. Now we know what antibiotics are and how they work. What's the antibiotic apocalypse? The term antibiotic apocalypse might seem like it's taken straight out of a science fiction novel, but it's an actual serious issue facing mankind that warrants attention. As a testament to the marvels of evolution, bacteria, over a period of time, can adapt, and they can develop resistance to some of our antibiotics, which diminishes the efficacy of some of these drugs. Now, while the presence of a few resistant bacteria might not pose a huge threat, because our immune system can still combat and control them, the real issue arises when these bacteria multiply and spread. Bacteria possess the ability to transfer some of their characteristics to other bacteria, even of a different type, and they can also salvage the DNA from dead bacteria. Again, even if it's a different type. So one single antibiotic-resistant bacteria could potentially disseminate its immunity and resistance to other bacteria types. This is what paves the way to the formation of superbugs, which are resistant to multiple forms of antibiotics. So why is this happening? There's a few different reasons, but the most common one you've probably heard is misuse or overuse of antibiotics. Like when people take them for viral infections, where they literally do nothing because they're only meant for bacterial infections, or when you don't finish your full prescribed course of antibiotics. Because what you're essentially doing by stopping your course early is letting some of the tougher bacteria survive, and they'll eventually learn how to fight off the drug. That's why it's important. If your doctor says take it for 7 days, you take it for the whole 7 days, even if you start feeling better early. There's also widespread overuse of antibiotics in the meat industry as well, which eventually makes its way into our guts when we eat that cheeseburger or steak. And it's not like we haven't known all of this. Even the godfather of antibiotics, Sir Alexander Fleming, warned back in 1946, the thoughtless person playing with penicillin treatment is morally responsible for the death of the man who finally succumbs to infection with the penicillin-resistant organism. He told the readers of the New York Times, "I hope this evil can be averted." But it's worth noting that it's not entirely our fault. Some of this is just nature and evolution doing what it's intended to do, adapting. Antibiotic resistance was around long before humans started using antibiotics. And we know this because the same genes that give bacteria resistance to today's antibiotics have been found in soil bacteria frozen in Arctic permafrost for over 30,000 years. So they've always had this ability. It's just that humans are making it easier for the bacteria to use this adaptation. So we're heading to this post-antibiotic era where some of our best defenses aren't going to work, and it's going to be a truly frightening place to live. Antibiotic resistance is already reaching dangerously high levels across the world. Drug-resistant infections already kill more than 1.2 million people a year, and this figure is projected to rise to over 10 million by 2050 if no action is taken, according to the World Health Organization. The WHO classifies antibiotic resistance as one of the greatest public health threats facing humanity. It's not just death and disability. Antimicrobial resistance also has significant economic costs. The World Bank estimates that it's going to cost the global economy $1 trillion of additional healthcare costs by 2050. So what role do our pets play in all of this? Well, this new study looked at cat and dog owners in Portugal and the UK. This was a prospective longitudinal study, so it follows the same bunch of people over a long period of time. And in Portugal, they had 43 households that had 78 humans inside, 5 cats and 38 dogs. In the UK, there were 22 households, 56 humans and 22 dogs. And the study focused on a specific group of bacteria called Enterobacterales, which is a family of bacteria that includes well-known bacteria like E. coli and Klebsiella pneumoniae. These bacteria, while often harmless, have the potential to cause a range of infections. And the study found evidence of multidrug-resistant bacteria being passed between sick dogs and cats to their healthy owners, meaning that our pets are acting as reservoirs of resistance and aiding the spread of these superbugs. The study looked at 2 really strong antibiotics that humanity has in our defense arsenal. These are 3rd-generation cephalosporins, which are really versatile antibiotics used to treat infections like meningitis, pneumonia, or sepsis. And resistance to this group of antibiotics poses a significant threat because they're classed as some of the most important antibiotics to human health by the World Health Organization. The other group of antibiotics in this study were carbapenems. These are super powerful drugs, basically considered a last resort. Doctors reserve them for situations when all other antibiotics have failed, or when they suspect a highly resistant infection. Resistance to carbapenems severely limits treatment options and most likely leads to patient death. In Portugal, 55.8% of pets and 35.9% of their owners carried bacteria resistant to 3rd-generation cephalosporins. 1 dog also carried a strain of E. coli that was resistant to carbapenems. 5 households in Portugal showed evidence of clear bacterial transmission between a pet and its owner. In the UK, 36.4% of pets and 12.5% of owners carry bacteria resistant to 3rd-generation cephalosporins. 1 dog with E. coli also had resistance to carbapenems and many other antibiotics. 2 households also showed matching resistant bacteria in both their pets and their owners. It wasn't possible to prove the direction of the transmission, but in 3 of the homes in Portugal, the tests suggested that bacteria was being passed from the pets to the humans. Now, I know what you're thinking. Why don't we just make more antibiotics? The answer is, it's not that easy. According to the Infectious Diseases Society of America, every single antibiotic that we currently use today is a derivative of an antibiotic discovery made before 1984. Antibiotics also represent a very tough scientific, regulatory, and economic challenge for drug makers. So it's no wonder they're not investing any money into this field. Our antibiotic pipeline of new drugs has been drying up for years because the pharmaceutical industry is looking for more profitable and lucrative markets like cancer treatment and heart disease. A course of antibiotics might be priced at $1,000, but chemotherapy for cancer can run into the tens of thousands of dollars. And a person might take a cholesterol-lowering drug for their heart disease for the rest of their life versus a single course of antibiotics. Okay, so we can't make new antibiotics and my pet's spreading antibiotic-resistant bacteria to me. What do I do? Well, you can understand how the bacteria is being spread. If you're having really close contact with your pet, like petting or cuddling or kissing, you're giving opportunities for the bacteria to transfer from your pet's fur or saliva to your skin. When you're cleaning the cat or dog litter, it's putting you in direct contact with the bacteria, which could be in their waste. And if your pet frequently climbs on furniture or sleeps in your bed, any bacteria that they carry can be easily transferred to these surfaces, exposing you later. While the risk of getting sick from your pet is quite low, simple hygiene practices can reduce the chance of transmission. So wash your hands for at least 20 seconds with soap. After you pet your animal, you play with them, or you clean their litter. This is especially crucial before you touch your face. Regularly clean and disinfect areas which your pet visits frequently, surfaces like food bowls, toys, and sleeping areas. And when your pet is sick, consider isolating them. So if your pet shows signs of illness, keep them confined to a specific area in your house so you avoid spreading the bacteria throughout the home, and thoroughly clean and disinfect areas where your pet's been. And the last one is don't use antibiotics unless you really have to. Now, while the study's findings are troubling, there's no need to panic. It's actually helpful because lead researcher of the study, Juliana Menezes, said this is a strong case for including pet-owning households in national programs that help monitor the spread of antibiotic resistance. So this should give us a better idea of the current state of resistance more accurately. And it does serve as a great wake-up call to take this issue seriously. As the WHO says, the fight against antibiotic resistance requires a One Health approach, recognizing that human, animal, and environment are all interlinked. And it's not all doom and gloom, because there's still hope. We have bacteriophages. These are viruses that eat bacteria, and we've known about these since 1915. We actually used phage therapy to treat gangrene in World War II. And active research is now looking at if we can use these to help in the upcoming antibiotic apocalypse. And as difficult as it is, we always have the hope of finding new antibiotics, especially with the advent of AI. In fact, to end the video on a positive note, scientists with the help of AI did discover a new class of antibiotics which can kill drug-resistant bacteria just last year. So now you know how cats and dogs are causing the antibiotic apocalypse. If you want more cat science, click subscribe and check out this video next.